Okay, we're live.
We're live?
We're live.
Morning, everyone. We don't have music because nobody brought their laptop computers today. All we got is phones. So Gwen wanted me to come on and do a quick Ask Me Anything. So we'll see how quick that goes. This is something I normally do for the supporters, but you'll get a little sampling of it. I don't have a phone in front of me, so Gwen is going to have to read questions to me. But this is your chance to perhaps maybe get some of your questions about your own specific pet or questions about feeding, products. This is your chance to ask and maybe get an answer.
Okay, so people are starting to sign on. For those of you that just clicked on, we're super casual today, so we're just going to answer, Dr. G's going to answer a few questions. So if you have any questions, type it in the comments, and we will try to get to as many as we can within reason.
I was showing off my cup.
Oh, I thought you were handing it to me.
No, I'm not handing it to you.
Oh, sorry.
I'm showing off.
I stole it.
She stole my coffee.
Whoopsies.
That is not being obeying.
They said you sound far away. Okay,
I'm far away, and I also have a froggy voice from the weekend.
This is actually a really good question. So, you often recommend adding fresh cranberries. How's the best way to do that? Do you have to cook them? And do you have any other suggestions around feeding cranberries?
You don't have to cook them, but you do have to smash them. When Mila was having chronic urinary tract infections, that's Gwen's big dog, she was adding cranberries about a quarter cup per meal. And I went to get a stool sample from the dog, and all I got was whole cranberries. You have to smash them. They have to be broken up. So you can run them through your food processor. You can cook them. That'll soften them and break them apart. If you've ever cooked cranberries in a pot, you hear them popping when the skin bursts. So, but yeah, they don't have to be cooked, but they do have to be broken down. Otherwise, they just come out whole.
Okay. Natural treatment for flea and ticks. We'll skip that one because we have a whole blog on the website.
There's a blog on that.
I'll post that.
The one called Natural Flea and Tick Revisited.
Should I start my dog on joint supplements at 2 years old if she does a lot of jumping?
It will not hurt, that is for sure. And if the dog has any conformational problems, so Brandon's new dog, Marlo, I came in this morning and he was standing there and I looked at him and I said, well, that dog's got bad hips. I can pretty much guarantee that just looking at the way he's standing. He's young. He needs to get started right away.
And would you suggest your senior formula or
Depends on the size of dog.
or wellness
so Marlo's
formula?
A big dog. We're either going to have to give a few of the wellness, or we'll pack more punch with the senior formula just because it's a more concentrated formula. So I probably would consider starting a big dog on the senior. For smaller dogs, just starting on the wellness, particularly a dog who doesn't have any issues, you're just doing it as preventative. For the dog that's doing a lot of agility or coursework, the wellness would be great.
Someone's asking, is there a certain number of days in a row below freezing where you can stop treating for fleas and ticks?
If you don't have any fleas in your house, the fleas are going to die outside as soon as you get even a couple of good frosts, so we don't have to worry about that. Ticks survive freezing. I don't treat our guys for fleas and ticks. I don't use chemical preventatives on our dogs ever. So it just depends on what the exposure level is for your dog. But ticks are, like in New Jersey, ticks are out 12 months out of the year. But there are certain times, usually October going into November and March going into April, when we get those seasonal changes. That's when we get a huge explosion in the tick population. So those are going to be the toughest times. And then it's definitely less in the winter when it's really cold and less in the summer when it's really dry.
Gotcha. On Instagram, Patty was asking for a 9-year-old Cavalier King Charles with luxating patellas. Do you have a specific supplement that you would recommend?
So it depends if they're bothering the dog. I would probably go with either my wellness or senior formula because we want to support the joints. I would use things like bone broth would be excellent. If they're bothering the dog, using the UC2, which is a cartilage product in addition. If we're trying to decrease pain and inflammation, we could go with something like the PEA. So lots of options there.
Cool. Someone was asking, it's Terry. Terry's asking, it was recommended that I give Katie melatonin for allergies. Is that good or bad in your opinion?
I have not specifically used it for allergies. And I've been reading a lot about melatonin recently, and the cases that I specifically have used it for have mostly been Cushing's dogs because it helps bind up some of the hormones that are in excess with the Cushing's dogs.
Gotcha. Have you heard of Methagel to neutralize the urine pH for steroid crystals?
So Methagel is methionine.
Okay.
It's lowering the urine pH. So the best way to lower the urine pH is to use a meat-based diet to make sure that you don't have any bacterial infection in the bladder. If that's not enough to keep the pH below 7 and you want that pH to be 6.5 to 7, you don't want to get it down to 5.5 or 6 because then you run the risk of oxalate stones. So I used Methagel and methionine tablets in my first year of practice back in 1984 and 85. Have not used it since then because when we put our animals on a species appropriate diet and make sure that we don't have urinary tract infection, we don't need it.
Okay, so kind of on the same line, on Instagram, we have a question about using Dr. Harmy's paradigm in a dog that has a history of UTIs.
Perfect, because there's no starches in there, so we're not going to be raising the pH, and it is a species appropriate diet as far as being very low starch and meat based, and the oils which are anti-inflammatory.
Kathy is asking, is the Lyme vaccine safe? Or I guess if you just talk a little bit about Lyme vaccine.
I don't recommend the Lyme vaccine. I'm pretty sure I have some blogs on that. If not, I'll have to write some. But the Lyme vaccine is only about 60% effective if your dog has ever had Lyme in their lifetime. It's about 80% effective if you start them as a young puppy. I think it's labeled to be started at either 10 or 12 weeks of age. So if you start then and they've never had a Lyme exposure, you're going to get maybe 80% effectiveness. There is some controversy over whether having the vaccine on board and then having an exposure to Lyme may actually make the problem worse. I don't recommend the vaccine because I recommend tick prevention. Giving the Lyme vaccine almost gives you a false sense of security because there's a dozen different tick-borne diseases that your dog can get, and there's a bunch of tick-borne diseases that your cat can get. So giving a vaccine for one, and we don't have vaccines for the others, and I wouldn't probably recommend them anyway. So I think it almost gives you a false sense of security. Lyme is treatable, you just have to catch it in the early stages.
Okay, I'm going to lump together two nutrition-related questions. So first from Linda. Hi, Linda. Hope you're doing well, by the way. How much eggshell do you recommend adding per pound of homemade raw?
Generally, 1 eggshell is going to be enough. Recommendations vary anywhere from 500 to 1,000 milligrams of calcium per pound of meat. So, and 1 eggshell, again, depending on this, not all eggs are created equal. Our chickens, the older ones, lay very thin-shelled eggs, which would have a lot less calcium than our young ones, which lay very thick-shelled eggs. But generally, 1 eggshell is going to have somewhere between that 500 and 1,000.
Okay, and then for if they're feeding your pup loaf raw, would they still need to steam and grind the vegetables?
Not necessarily. Well, grind, yes. They need to be processed in some manner. So you can steam them if you want to, but they absolutely would need to be ground to break down those plant cell walls.
Perfect. Someone, Terry would like to know where you got your jacket because she loves it.
Oh man, I thought that was a trip to California.
Okay, there's tons of questions about fleas and ticks. Maybe we could just post, we have tons of info on this, so maybe we could just post that blog afterwards for all of you that have flea and tick questions. Okay, hold on, there's a lot of comments, but not a lot of questions right here. Okay. Oh, how do you feel about an anesthetic dental cleaning for a 13-year-old Cavalier that has Cushing's and mitral valve disease?
You would have to, one, get clearance from the cardiologist. Just because they have mitral valve disease does not mean that they cannot undergo anesthesia. All of our dogs have undergone anesthesia with their mitral valve disease, even as late as stage D. We've done a ton of monkey's house dogs with advanced heart disease and put them under anesthesia. Cushing's per se would not stop me from putting an animal under anesthesia either. So it's up to your veterinarian, and kind of depends on the status of the teeth. But having rotten, infected, loose, painful teeth is a very big problem for a dog.
Teresa would like to know how you feel about the allergy drops / shots for dogs.
Oh, so immunotherapy.
Yeah.
We did it a lot in our practice. It's not a cure-all. I would say that it gives us 75 to 80% improvement in most patients. Some of them we get more than that. And a lot of times what it'll do is it'll reduce their symptoms to the point where we're not having to use steroids. We never use Cytopoint or Apoquel anyway, but a lot of times it would get us back down to maybe a week or two out of the year, maybe in their worst season, spring or fall, where we might need to supplement with an antihistamine or an herb. But we had good success with them.
Okay. I'm going to do a few more unless you want to stop. Just tell me whenever you want to stop. Okay. On Instagram, Zoe wants to know, is it okay to titer test a 17-week-old puppy?
Depends when the last vaccine was given. So you want to wait for at least, I would say, 3 weeks after the last vaccine was given, and then absolutely. So in my practice, it kind of depended where they got when they got their vaccine. Some people wanted to just give one at 12 weeks, and then we could titer 16 weeks or later. If we just gave one at 16 weeks, or if we gave a couple and we ended at 16 weeks, then we would do the titer at 20 weeks. So it just depends. You want it to be at least 3 weeks past that last vaccine.
And can you just quickly talk about what a titer is for those that might be a little bit newer?
So a titer is a blood test looking for antibodies against certain diseases. So the three that we most commonly, well, there's four that we commonly will titer for. One is distemper, one is parvo, hepatitis, which is the A in the DAP, and then you can titer for rabies, although most licensing agencies will not accept a rabies titer for licensing purposes. But if you just want to know if your pet is protected, then you can get that. So we strongly recommend, instead of vaccinating, if your pet has had a vaccine at any time in the past, for distemper, hepatitis, parvo, rabies, whatever, and you get that notice that says they're due for a booster, instead you should ask for a blood test called a titer, T-I-T-E-R. It should not be horrendously expensive. Some veterinarians will charge $200 to $300 for a titer because they really just don't want to be bothered and don't understand the science behind it. You can get them for much less. You can have it sent to Protect the Pets, which is Dr. Rob. You can have them sent to Kansas State University Veterinary Diagnostic Lab. You can have them sent to Gene Dodds, hemopet.org. If it comes back that your pet has a positive titer for any of those diseases, they don't need to get a vaccine for anything that they have a positive titer. Basically, the blood test is telling you, hey, he's got protection. Why would I jab him again?
Perfect. Wendy would like to know, once I transition my dog to a new food, and if I haven't fed the old food in a few weeks, do I need to do a slow reintroduction of that food again? So if you're switching back and forth between different foods.
They should be able to tolerate it. If they were tolerating it before, they should be able to tolerate it again.
Oh, Holistic Vet UK joined us on Instagram. Hey, Dr. Nick. We're big Dr. Nick fans over here.
Huge.
Okay. Renee said, funny you mentioned the cranberries popping. I didn't know what was going on in my dog food pot the other day.
Cranberries popping. Yep, sounds like popcorn.
Yeah, okay. So Nikki would like to know, while repairing a dog's gut, is there anything you recommend for itchy skin and itchy ears?
Well, that's toxins making their way out of the body. They got to go somewhere. So, they're either getting pooped out and processed by the liver, and, you might get some loose stools. But ear infections and skin problems could be yeast that you're dealing with, an overgrowth. So while you're repairing the gut, you want to make sure that you are feeding a species-appropriate diet, that we've gotten the starchy carbs out of there. Dr. Nick will back me up on this one. That we've gotten the starchy carbs out of there, that we're using things that are draining for the system to help detox the system. So I love using things like asparagus, daikon radish, dandelion greens, mustard greens. The dark bitter greens are very good for that. And then, find a probiotic that is going to work, whether you're using a leaky gut protocol from Adored Beast or trying a soil-based probiotic. There's a lot of different ways you can approach that. And depending on where the problem is in the skin, sometimes Chinese herbs will help, particularly for the gooey ears. There's an herb called Long Dan Sheganwan, which is amazing for draining the gallbladder and liver meridians. The gallbladder meridian goes back and forth around the face and the ears and down under the neck. So for those dogs that have the gooey ears, itchy around the eyes, they've got that black thickened skin on the neck and the armpits, that herb works incredibly well.
Cool. All right. I am feeding Dr. Harvey's raw vibrance, and ever since I started, my Belgian won't finish his entire meal. It looks like she even decreased the number of scoops of raw vibrance and trying to add bone broth. He used to eat pre-made frozen raw. Is there anything else she could do, or does he just not like raw vibrance?
He may not like raw vibrance. He might try the Paradigm instead. I find that my dogs like Paradigm better than raw vibrance. Sometimes you just have to switch off, and there are some dogs that just don't like the green stuff in their food. If I use it at the full dose, my dogs will back off. I use a lower dose than what is recommended for my guys, because I know they're getting their vitamins and minerals from other sources as well.
Okay, we're going to do one last question, and it's from Instagram. What are your thoughts on adding vitamin C to a dog's diet? I recently read about the benefits, and I'm thinking of trying it on my dog who has hip dysplasia.
Yeah, so vitamin C can be excellent for joint disease. It's a great antioxidant, so cancer prevention, cancer treatment. The only issue with vitamin C is that we do need to use a buffered vitamin C, and if you use too much vitamin C, you will get diarrhea from the pet, so titrate up slowly till you find that breaking point where, so you might look at a product that has dosing on it, and it might, let's just say it says 3 capsules a day for that size dog. Start with 1, use that for a few days, then go to 2, use that for a few days. Work your way up slowly, watch the stool. If it's starting to soften, you might be hitting that point where your pet's bowel can't handle any more than that. But vitamin C, I've had very good luck, particularly for hip dysplasia dogs.
Okay, perfect. Thanks, Dr. Judy. So for those of you that missed the beginning, this was just a little Ask Me Anything. She does these sometimes for Facebook supporters. So on the Judy Morgan DVM page, if you want to become a supporter, it's $10 a month. You get some extra perks. But we try to do these every once in a while. I know there's tons of questions we didn't get to, but we'll
always
yeah, but we'll definitely post more information about the flea and tick stuff, because there's tons of questions on that. And anything else, we will try to go through the comments and post after this. All right, everyone says thank you, and you're awesome. Okay, bye.